Joined now by Watford MP Dean Russell. Watford? You are Mr. Watford, but Dean, welcome to the show.
Hi, Miles. How are you?
I'm all right, thank you. How are you?
I'll start calling you Vibe.
oh God! Don't insult the other presenters like that. They're all much better than me. Dean, how have you been this week?
Yeah, good. Thanks. Just busy. You know, we're with the new announcements. Every time there's a new announcement each week, there's usually a flurry of emails and questions and queries. So, been lots of emails this week. I've had the Health Select Committee as well, which was particularly interesting, and got to ask 3 questions in that, so I can cover some of those if it's useful. But yeah, it's just been a busy week, really almost relentless, but you know, I wouldn't change a thing. From a personal perspective, I really do feel privileged to be in the position that I am, so just trying to help as many people as I can. Absolutely.
If you do have a question for Dean, 82818 is our number here at Vibes. Start your text with Vibes so it comes through to us. Speaking about the lockdown regulations that have been eased, Boris Johnson's announcement on Monday was quite big. It gave us more of a clear indication as to how things will work. He did use the word conditionally, which I thought was very important, that it'll only happen if we keep following government guidelines. We're moving towards step 3 at the moment of his 5-step COVID-19 sort of outline. What's your opinion of the easing of the guidelines at the moment? Do you think that it's a good idea, or do you think the government's just reacting to the fact that people were sort of starting to take it in their own hands and just come out of lockdown anyway?
No, I mean, throughout this, the goal has been to follow the recommendations we're given from a scientific perspective, or rather to build upon those. We don't necessarily just do exactly what the scientists say, in terms of there's got to be a judgment there as well. And you know, the lockdown period has been a success in the sense that we seem to have flattened the curve and now coming out of it, and we've had a reduction in infection rates. And so it's right to start gently, and it is very gently, and I know the phrase the Prime Minister's used is baby steps, to start to look at coming out of that lockdown at the moment. But I think the big announcement, which hasn't really been, I think, picked up as much in the press as I would hope, is the fact that we now have this alert system. So the premise of the alert system means that rather than a very binary approach of, you know, are we in lockdown or are we not, it's more about how do we start to ease the lockdown as we have this R number drop in terms of the number of infections and the infection rate, or strengthen the lockdown if it starts to go up. And by having that graduation means that we can then start to ease things in a very small way, which is really what's happened this week. I mean, in effect, the lockdown measures have been eased very, very slightly to enable people to go out for longer periods for exercise and so on, but it's not lifted it fully, and I think that's right, you know, to be able to try that. But what we're very clear on is that this isn't going to be a case that that's it, because if infections start going up, we may have to increase and strengthen lockdown again. If they continue to drop whilst we're in this period, then hopefully we can ease things a bit more. So it's really a case of doing the right thing and taking those measures in a very, very cautious way.
We need to talk about care homes, Dean. It's been estimated now that 20,000 lives have been lost in care homes. It's, of course, an absolute tragedy, but it's making front page news, it's making the headlines, it's turning into a bit of a national scandal. You are a member of the Health and Social Care Select Committee. Do you have some questions regarding this for the government?
Well, yeah, I mean, I think there's several aspects to it. I mean, the first thing I'd say is that, you know, it really is so saddening, and it really does break my heart when you hear of the numbers of deaths, because behind every single one of those deaths is a family and a life story and everything, and it's just, you know, it's awful to hear those, and I sadly, in my role, hear more detail than most in terms of people impacted by it. So the goal is always to limit the number of lives lost by to zero if possible, but as much as possible. And I think, you know, the challenge with care homes is that in terms of the profile of people who are there, obviously they're going to be more vulnerable. They're at the older age limit, but that doesn't mean that they should be put at any extra risk. And I think for me, for the Select Committee, we're going to be speaking next week around social care more generally, and I'm keen that we touch upon care homes as much as we can. But with regards to that, my questions are, especially for looking at this new £600 million that's been put in place by the government around infection control, how that's going to be used, what that's going to be going to look like in terms of the distribution across councils, what lessons have we learnt so far. I mean, the good news, I suppose, if you can call it that, is that care homes seem to be in a much better place now than they were a few weeks ago. But there are questions, in particular, when we look back as well. I mean, as far as I understand, care homes were one of the first areas that were locked down fully.
When you say in a much better place, just quickly going back to that point, Dean, can you could expand on that slightly for us?
Yeah, sure. I just mean in terms of the number of infections and number of deaths in care homes seems to be dropping. But it's when I say it's it seems to be improving, but it still doesn't mean that what's happened so far isn't an absolute tragedy. And so we've got to look at what's happened, but also how did the infections get into the care homes in the first place? They were in lockdown in early stages. Especially when we're looking at private care homes, what was the situation with PPE and so on. But I think at the moment we've got to really make sure we don't get into a sort of a blame game approach. For me, it's very much about how can we properly learn from this, and I think that's what's really been powerful for me on the Health and Social Care Select Committee, and really important, is that we're able to scrutinise quite a lot of depth. Some of the questions we ask are really tough questions, very tough questions, but it's to try and learn how do we stop this from happening again. What could we have done differently? Could we have done anything differently? I mean, there's a whole load of questions there that need to be unpicked, because the truth is, at the moment, we don't have a cure for coronavirus. There isn't at the moment, there isn't a vaccine. I mean, there's loads of amazing work happening in that space. So at the moment, it's still out there, and we've just got to try and reduce the number of people who are infected. So any learnings we can get from the past few months, and if you think it's Christmas, no one had heard of this thing. January, not many people had, and now it's affected the world. So we've got to unpick that. What learnings have we got? How rapidly has this changed society? And what is it that we need to do moving forward to keep reducing those infections, to protect our most vulnerable in society? And within the Health and Social Care Select Committee, and also the joint Committee on Human Rights that I'm on as well, look at those aspects in a lot of detail to say, well, what could we have done differently? What should we have done differently? Should we have done anything differently at all? Which I think with the results of what's happened the past few months, there will definitely be learnings, and where do we go from there? But it's a very serious, and a very serious set of questions, and I think there's no one even in government is shying away from those questions, because we ask ourselves, and MPs on all sides are asking each other and government, what should we be doing differently moving forward to protect lives and protect people across the country, and from my perspective, especially here in Watford.
Now, there were mixed reactions to Boris's statement on Monday. Some people were slightly confused about what he was saying. Others saw it as a little bit of a glimmer of hope as to how things are going to work moving forward. And talking about moving forward, once we come out of lockdown and things start to get back to normal, the government has pledged to invest in rapid road alterations to promote walking and cycling to help keep people off public transport, really. Are you going to be pushing for that investment to be shown in Watford, to alter the roads in Watford to get people out and off public transport, so that it's not... Self-dependent doesn't seem like the right word, but they're not depending on having to be on a crowded bus or train all the time.
Yeah, I mean, I think I need to often, from a political perspective, roads are very much in the realm of Hertfordshire County Council. Yeah. Obviously, there's aspects of that within the very local Watford Borough Council. So there's aspects of that I will no doubt be involved in, but not actively overseeing it and making sure it happens. I think the main thing really is just making sure that life isn't made more difficult for people. I mean, that's my main goal, is that, if people need to get to work and they can get to work, that we shouldn't be putting barriers in the way to do it. I think the push really with the announcements were twofold. One was that, the announcement to say use your car if you can, or cycle or walk to work if you can, is really to then mean that less people are using public transport, so those that have to use it to get to work are able to do so safely. So it's almost a case of enabling that within social distancing. I think the other aspect to it is that we've got to make sure that this is sustainable long term, and that's why the government wants to put money into this, to make sure that over time this becomes something that perhaps can be beneficial to people, so that it is safer to cycle around different areas. It is possible for us to go on journeys without necessarily using the car and so on. And I think that really ties also into the bigger environmental message. I think one of the things we've seen massively around the world is the drop in air pollution and the increase in air quality around the world in cities that, for decades have just got used to having that little bit of mist in the air, that little bit of air pollution, and you see these incredible photos now of cities where you can see the skyline for miles, where you used to not be able to see it at all. And so I think there's a bigger piece here as well around, how do we protect, the air around us, how do we improve the life quality around us and the air quality around us. So I think that's going to be really important. One thing that I am going to be doing, though, is asking, because I know that the government's doing a lot of work with the Transport for London, and I'm going to be seeing whether some of that funding, it's possible for us to look again at the Met Line and the Metropolitan line into Watford, because the extension of the Met Line now, it may be that they say, well, look, this is emergency money for a very emergency situation. But if it's a case that we can try and get another look again at the extension of the Met Line into Watford, then I'd love to do that. And I know I've been lobbied on that very heavily for many, many months, and I'm very much in agreement that if that we could do that, then that would also give another route into London and to hopefully take the pressure off some of the trains. The other thing on that as well is that I am speaking to the train franchise that goes into London through Watford soon, in the next day or two, and the idea is to ask them, what are the measures going to be on the trains, how often will they be running. I know prior to the new timetable, which was due to be out a month or two ago, that the trains last year was an absolute nightmare, and prior to everything happening with coronavirus, I was very tough on the local train franchise. I organised for the local MPs in the area to get together so that we could come together as one and say, look, we've got to sort this out, because commuters were getting a really rough deal, I thought, in terms of the quality of the trains. Annoyingly, just before coronavirus hit, I'd managed to get quite a big success in making sure that the trains were train franchises agreed that we'd get 12 carriages rather than 4 on many of the very early morning routes. But then coronavirus hit just as they started to do that, and everything had to change. But I'm definitely going to be looking at that, because the reality is, life will go on, and we need to make sure that commuters, when they can get into London, when they do need to get into London, are getting there and back without feeling like it's an absolute dread on what the commute is going to be like.
The government has been criticised by some people. It was always going to happen, no matter who's in government at this point. During something like this, they will face criticism from some sectors of society. It happens all over the world. It happens with every single government. One of the people who's been increasingly critical is Jeremy Hunt. He's the chair of the Health and Social Care Committee. He's been increasingly critical, but when he was the health secretary 3 years ago, the NHS failed a major pandemic test, and it doesn't seem like a lot's been done. Do you stand with him in his criticisms, or do you have different views to Jeremy Hunt at this point in time?
Well, I think what Jeremy's doing really is just being what his role is within as the chair of the Health and Social Care Select Committee, and I have an incredible respect for Jeremy. I've been working very closely with him through that, and have quite a privileged position that I've been speaking very regularly to Matt Hancock and his team, and also through the Select Committee with Jeremy. So huge respect on all sides. What he's really being is a critical friend, and his role within that committee, and all of our roles within that committee actually, are to ask tough questions, but not to try and catch people out or play gotcha, but to say, look, what are we doing about this particular area? I know Jeremy raised in Parliament just the other day about, should we have been looking at this from the start in a different way? I know he was quite critical of the scientific advice, in the sense of should we been, when you look at what's happening in the response in Asia, for example, they were looking at a pandemic plan around a more sort of SARS approach, whereas our pandemic planning here was much more around the flu style epidemic. And in hindsight, of course, there's 1,000 things that perhaps we could have looked at differently, but that's hindsight. And I think my view on it is what Jeremy's doing is the right thing. He's raising questions so that we can look at those in a different light, and he's doing it, I think, in a pretty constructive way. And through the Select Committee, it means that actually we're able to, like I say, ask really tough questions. And it is a weird thing, imagine being I'm a new MP, and in my role as a new MP, I'm having to ask people on my own side, as it were, questions that might seem like I'm attacking them, but actually it's not, and it's never meant for that reason. It's to say, look, where can we go from here with that? And I think it's only right. It's about scrutiny. It's
a bit different, isn't it, to a normal when you first start your job. You spend your first couple of months head down, doing what you're told, but you have to be in there. But that is the job. So you have to represent the people of Watford, and to do that, you have to make sure that everyone's safe and healthy where they can be.
Oh, absolutely. And my role, my first priority is to make sure that people in Watford are safe, that we're looking after them, that their voice is heard. And I do feel very privileged, to be an MP, but also to be on the committees that I am, because the Human Rights Committee and the Health and Social Care Select Committee are two of the biggest committees at the moment, I would say. And so there's a lot of weight on my shoulders to get it right. But it also means that, I'm under scrutiny, because if I gave the government an easy time, as with Jeremy, then actually we wouldn't be doing what we should be doing, which is holding them to account. But B, we might not be asking questions then if that could make a difference in the future. And so just two examples, actually, of ones that I've asked previously in the early stages. I remember asking, I can't remember if it was Professor Chris Whitty or Professor Patrick Valance, but very early in the stages on the Select Committee, I was being asked a lot about when we will be closing schools. I asked about that. Within about 2-3 days, schools were closed. I'm not saying it was because of my question, but it came just before that point, and I was pleased that then that happened. Just last week, I asked the Select Committee, and this one was to Sir Patrick Valance, about should people be wearing face masks, and obviously that was then or face coverings. That then was in part of the lockdown guidance, that if you're in a shop or a contained busy area, you should be wearing a sort of homemade or non-surgical face covering. So there's lots of things like that, and I could probably give you a long list. But the reality is, it's important, because people want to know those answers, and if we're not asking them to those people, where else are they going to get the answers from? And so I feel very strongly that it's not about trying to play gotcha. It's very much about asking the right questions, and sometimes there will be tough questions, but it's important because we've got to learn through this, and we're still only 4 or 5 months into this pandemic, and really only three months into the real full impact of it. And so if we don't get this right and ask the questions now so we can get it right moving forward, then it's the wrong, I wouldn't feel comfortable with myself. So, we have to do this, and we've got to get it right. And this is, as some people say, a marathon, not a sprint.
Let's quickly end with something a little bit more positive. You posted a video during the week. World champion boxer, 9-time world champion, Nonito Flash Donaire, thanking the Filipino staff at Watford General Hospital, the NHS staff. The first thing quickly is, right at the start, he said, "My friend Dean Russell." That's an unlikely partnership. How are you friends? How does this happen?
So I've led quite an eclectic life, but one of the things I was involved in a couple of years ago, 2-3 years ago, was I did some charity missions in the Philippines, literally in the Filipino jungle. And it was involved with helping build a village out there for people who were impacted by Typhoon Haiyan. So a few years ago, very sadly, Typhoon Haiyan hit the Philippines, and an awful lot of lives were lost. But also the devastation of that lasted years. It still continues today in some ways. And people didn't just lose belongings; they literally lost family members, and it's awful situation. And so I was over there helping with building this village. And when we launched the village, Nonito Donaire, who's literally a legend in the Philippines, a lovely guy, was out there, and I just became good friends with him. He's a lovely man, an incredible boxer. I mean, he's a 9-time world champion. He's won bouts in, I think, 4 different weights. I mean, incredible. I mean, he's known as a Filipino Flash because he's so quick. And so we're just really good friends. I've got to meet, over the years, quite a few different celebrities through different routes, rather bizarrely, from Oscar winners to Grammy winners and all sorts. But with Nonito, when I was chatting to him the other week, I was just saying, how amazing the NHS are, because I was saying about the shifts that I've been doing there, and we were just having a chat. And I was saying about the fact that, the Filipino community in particular, because of his connection at Watford General Hospital, and the carers across Watford as well, because some family members I know have a Filipino carer that comes in. Just how wonderful they've been, how supportive they've been, how hard they work, and just how wonderful they are. And I was just saying to him how grateful I am for everything that they're doing. And it was just a casual conversation, and it occurred to me while we were chatting, perhaps they'd love a video from you. So he without literally in a flash, excuse the pun, given his nickname, but he was like, "Oh, I'll do a video for them." So he, very kindly, he did that little video just to say thank you to them and all our NHS workers, and what superheroes they are. But it was really lovely of him, actually. I was really pleased he did it, and I just hope that within the Filipino community across Watford and across the UK, actually, that they see that, because I know with Nonito, he's, especially in the Philippines, just one quick story on that, actually. One evening we were chatting, we were in our hotel, and it was about, it must have been about midnight, and the hotel area kept filling up around us while we were just having a general chat, and it was getting busier and busier, and I'd assumed naively that it was perhaps there'd been a conference on or a concert or something, and people were going in for a drink afterwards, but they were all sat around really super quiet, and Nonito, it was his wife there as well, and a few others, and we were chatting away, and then we finished for the evening, stood up. This must have been about 12:30 at night by this time. Stand up, and literally within a second, all of these people who'd been sat quietly having very quiet conversations all stood up and came over to Nonito for photos and
amazing.
And they'd actually just heard that he was there and just turned up en masse, all as fans. So he's really well loved there, and so I was pleased to be able to do that.
That would have meant a lot to the NHS staff, I'm sure. Dean, we're going to have to leave it there for time. Thank you so much for joining me this morning. We'll speak again very soon. Enjoy your weekend.